discussing just the nutrition components of the Farm Bill, and then there will be others that will deal with the agriculture section of this. So we'll go to the next slide, please. Okay, on this slide, this is just a kind of as you'll see on the left, is a chart showing the funding in the Farm Bill. And as we talked during 101, the majority, or as with this one, it was 76% of the funding in the Farm Bill went to federal nutrition programs. And what I need to point out is when I'm talking about federal nutrition programs, I'm not referencing the child nutrition program. So we're not talking about school lunch. We're not talking about breakfast, summer feeding, or after school meals. This is just strictly the federal nutrition programs, and we'll go in deeper on some of those through this with this presentation. The illustration on the right, I think, is just a great. This is what President Obama said about the Farm Bill, that it was the Swiss Army knife kind of a bill. There's so much included in it, just like there is with a Swiss Army knife. So many functions that you can have. Next slide. So again, just a little bit of a summary. The Farm Bill is reauthorized every 5 years. The last one was passed in 2018, and it expires September 30th of 2023. So we are hoping that there will be a Farm Bill, another Farm Bill will be reauthorized by September 30th of 2023. But hearing that it may be a little bit longer than that, just not sure at this point. And there are 12 titles, as we covered before, in the Farm Bill. And the one we are focusing on today is Title 4, which is the nutrition portion of the Farm Bill. Next slide. So let's review some of the changes that were in the last Farm Bill. And SNAP was protected and strengthened through the Farm Bill by requiring that now every 5 years, the Thrifty Food Plan needs to be reevaluated. The Thrifty Food Plan is what SNAP or food stamp allotments are based on. And prior, when this was passed, the Thrifty Food Plan had not been reevaluated since the 70s. And we know that food prices have changed drastically during that time. So USDA did complete a reevaluation, and the new benefit allotments went into effect October 1st of 2021. And it was basically a 21% increase across the board. It reauthorized TFAP, the Emergency Food Assistance Program, which we'll go into more in another slide, as well as CSFP, or the Commodity Supplemental Food Program, which we'll discuss again. Most of these, as I say, we'll cover more in depth. It strengthened the food distribution program on Indian reservations, or referred to as Fifth Dipper. Gotta love the government and their acronyms. And that included self-determination in food purchasing by the tribal organizations. Prior to this, they were not really consulted. The tribal organizations were not consulted on the food that was in that program, and this required that USDA coordinate with the tribal organizations for food purchases. Next slide, please. And the next two improvements that were made turned out to be very timely and very important during COVID. So it broadened the definition of SNAP retail stores to include online entities, and then it also required the nationwide implementation of online acceptance of SNAP benefits. So what we saw with the onset of COVID, the pandemic, was that stores that had not participated in the online acceptance of SNAP were accepting that, because that was how people were having to shop. So it was great before Amazon, when it says retail food stores. I mean, Amazon was part of the organizations, the very early ones accepting it. But even though Whole Foods is their food provider, they're not everywhere. So again, that really helped during the time of the pandemic. It also renamed the Food Insecurity Nutrition Incentives to the long name Gus Schumacher Food Insecurity Nutrition Incentive Program. The short is GUSNIP. And what you need with GUSNIP, while it does many things, one of the things that is included in that is like your double bucks for farmers markets or purchases of food at grocery stores where the SNAP benefits are increased with those purchases. Next slide. Talk a little bit about the importance of SNAP right here. SNAP is the nation's first line of defense against hunger. It's again also known as food stamps, but in North Carolina, we do refer to it as Food Nutrition Services, or FNS. And it helps put food on the table. In the month of September, we know that USDA reported that over 41 million households, individuals did receive SNAP benefits. And so, as I say, it really is the nation's first line of defense. So, next. And as we discussed in the 101 series, we talked about marker bills, and there are several nutrition marker bills that have already been introduced. And while there's no action on them, but again, a marker bill, just to kind of reiterate what was said during the 101, is basically your trial balloon, just to see what is the support for those marker bills, for those provisions. Next slide, please. Okay, so one of the bills introduced was closing the meal gap. And this was one of the co-sponsors that signed on was Representative Alma Adams. It was asking that the base SNAP benefit allotments on the more adequate low-cost food plan. I talked about the Thrifty Food Plan, which is kind of like the lowest plan that they can base SNAP benefits on. So it was asking this bill that it would be raised up to the low-cost food plan, which would allow more per cost of per meal for each individual. The next were to boost SNAP benefits for families with children and for seniors. We know that families are having to make hard choices between food and paying their shelter expenses. So we want to boost that, but we also know for seniors that it is very difficult. They're having to make that hard decision whether or not to purchase food or to purchase their medicine. So we would like to see those benefits boosted. I know that there's an error on this next one, but again, it is how the bill was introduced, so we did not make that change. But it was to boost SNAP minimum allotment from higher, which currently at that time it was only $20. But with the reevaluation of the Thrifty Food Plan, the minimum allotment is now $23 a month. The amount that I have seen suggested that they increase it to is the minimum allotment to $30 a month. But we really do hear from households, if they've been approved for the $20, that they really don't see the benefit of it. You have to go in and be reapplied. They just see it as it's not worth their time. We always try to explain to them the benefits stay on your EBT card for up to a year. Save it up for Thanksgiving, save it up for Christmas. Then that helps you buy those big meals. But as I say, $20 for a lot of households, they don't see that as a benefit to keep going back in for the recertifications. We'll go a little bit more into this other one in another slide, but improve equitable access by extending SNAP to Puerto Rico and other U.S. territories. And as I say, we'll go into that a little bit deeper on another slide. Next slide, please. Improving access to Nutrition Act of 2021, which is just, you may have heard the term ABOD used with SNAP. ABOD stands for Able-Bodied Adults Without Dependents. And right now, the SNAP regulations say, there's a waiver in place, but the regulation says an able-bodied adult without dependents, they don't meet any other work exemptions, can receive SNAP benefits for 3 months out of 36. Now, there's a waiver in place that has lifted that during COVID, but with the public health emergency expiring, it will go away. And this really penalizes households that people are looking for work, but they aren't able to get a job. So we want to keep feeding them during this time. So as I say, we would like to see that arbitrary 3 months time limit removed. Next slide. Enhance access to SNAP. Right now, college students are again, there are waivers in place that have during COVID that have kind of changed a couple of the rules, but if it was just without the public health emergency, college students to be eligible for SNAP benefits have to be enrolled full-time and working 20 hours a week. That to me is just an impossible ask, that someone be enrolled full-time and working 20 hours a week. So we want to make it easier for college students to be able to receive the help they need while they're in school. And we do know that studies have shown that, like with community colleges, that 40% of the students that drop out are dropping out because of food insecurity, that they need to go to work. So we need to make it easier for the household, for college students to receive those benefits to support them while they are in school. Next slide. The Lift the Bar Act is going to be addressing immigrants who are here lawfully. And right now there's a 5-year waiting period for them to be able to receive SNAP. We would like to see that eliminated. And then also for households or immigrants who come here with a sponsor, that they are able to have access to the services they need when they come to this country. And again, that's for those with sponsors. But then also for those who meet the definition of qualified non-citizen, they're eligible for other federal programs, but not SNAP. So want to make them, where they can also receive that just like as they do with other federal benefits. Next. How can we improve the 2023 Farm Bill? We've already discussed with the marker bills, things that we would like to see included in the 2023 Farm Bill when, as I say, when it affects SNAP. But let's talk about some of the other programs. The Emergency Food Assistance Program, or TFAP, equitable food access for Indian country and Puerto Rico and the U.S. territories. And I will go ahead, I will say here that Indian country is how it is addressed in the federal regulation. So that's why you see it referred to as Indian country. Support policies to enable easier food donations, and then also the commodity supplemental food program. So we're going to dive in a little bit deeper on those items that I just mentioned. So next. Okay. TFAP, the Emergency Food Assistance Program, is the cornerstone of the Charitable Food Assistance Network. It is on average about 1/3 of the product that food banks and their partner agency networks distribute. And it is also some of the healthiest product that we do provide. Also, one aspect of TFAP is that it is a way of supporting American agriculture, because this product is purchased from local growers. I should not say that nationwide right now. It's not necessarily local growers, but again, it is food that has been raised in the United States and produced in the United States. So, this, as I say, is supporting agriculture as well as supporting households that need food assistance. And in the next Farm Bill, we want to see the mandatory funding for TFAP be raised. The interesting thing is that while they, again, as you know, with this, while it might be mandatory when you come to appropriations, it might not be funded at that level, which is what has happened with TFAP. But we need more additional funding going in that program to be able to purchase more product. Next slide. Ensure equitable food access. And listed as Indian country, Puerto Rico, and U.S. territories. Right now, there, as I mentioned earlier, the Fifth Dipper program, the food distribution program on Indian reservations, provides a monthly box of food to households that live on tribal lands. They are not, if they receive Fifth Dipper, those households cannot receive SNAP benefits. This is the only program that does not allow for you to receive from more than one program, food assistance from more than one. If households receive TFAP benefits, like through our partner agencies, we use SNAP as one of the ways to determine their eligibility. So again, this is an inequity that you've got where they can't receive both programs. So we want to see that policy changed. But also, when you look at Puerto Rico and 2 other of our U.S. territories, we have 5 U.S. territories, and 3 don't receive SNAP. They actually receive a program called NAP, or Nutrition Assistance Program. That is a block grant. So it's a certain amount of funding that is allocated to those territories every year. And the great thing that we know about SNAP is that it expands during economic downturns and it retracts when the economy gets better. With a block grant, you can't do that. You've got that finite amount of money. It may have already all been allocated. Think about when pandemic hit and we saw increase in demand for food assistance. They did too, but they did not have that flexibility as the government, as the federal, as the SNAP program did, to be able to expand and, to meet the demand at that time. So we want to have that all of our U.S. territories are able to participate in SNAP and not limit them to the block grant NAP program. Next slide. And we want to support policies to enable easier food donations. We want it to be easier for our farmers to donate to food assistance programs. And, there are barriers to them donating that an agency they're donating has to have a matching amount of money to match. If it's a grant, they have to be able to match that. It should just be that they're able to donate the food or either that the money is provided to purchase for them. We would much rather purchase food from those. But also when we think about retail stores, the guidelines are very strict on what can be donated. And there's many times safe, wholesome, nutritious food is not able to be donated because of those restrictions. So we would like to see those restrictions eased so that this food does not go into waste, but is able to go to households. And again, it is safe, wholesome food that we're talking about. Next slide. The Commodity Supplemental Food Program. We would like to see the funding for that program increased. This program, or CSFP, is a program that is for seniors, and it's a food box delivered to their home every month. And caseloads are established by USDA through the funding that's in the Farm Bill. And again, it is a limited number of caseloads. For the caseload, it does not cover every senior who is eligible in any state. So we would like to see that increased so that there's more food going to senior homes. And again, it's a box of healthy food. It's locally, again, it is US produced agriculture or products. So as I say, we want to be able to get more food into the senior households. next. And as we breezed right through that, are there any questions about this? You'll put them in the chat box.
I actually have a question.
Okay.
I'm curious how much of the nutrition title is these like marker bills that are quite specific versus SNAP, which obviously we know is a huge program. And I guess what I'm asking is like, how much of the nutrition title is new presented marker bills? Is this going to be an area that is like highly debated or something that our representatives might not be paying as much attention to?
I don't know that we have a cost, if that's what you're asking, Brett, or a percentage for that. Did I understand your question correctly?
Is it typical to have this many marker bills in the nutrition title?
Yes.
And are they usually this specific?
Yes, very detailed as to what you're asking for. So yeah, that's not unusual for it to be that they are asking for specific things. And again, it's with nutrition, with the nutrition marker bills, you're just seeing that they're going, asking for things that would increase either the food coming in or increasing access for the households or easier access for them.
Thank you.
Hey, Jan, I had a question. So I know that right now, while the public health emergency is still in effect, we're, as far as SNAP is concerned, we don't have those work requirements for able-bodied adults without dependents, or those same requirements for students who are in college. Do you think because those things are happening right now that there might be like more political will or support to kind of like continue those, and like those kinds of marker bills might get more support behind them? I know I'm like asking you to speculate, but but we're seeing those in action now. Like, do you think that would create any kind of momentum to kind of keep those going? What are your thoughts on that?
Yeah, Mary, great question. You were, as I say, really, kind of asking, for the crystal ball here, and I would say that it probably has created more political will for these, because we did, during the pandemic, a lot of these things were in place, and we didn't see food insecurity rise during that time. It maintained level. We also saw with some of the things that didn't actually relate to food, but we saw child poverty drop with some of the things that were put in place. So I think we've seen that these policies, are much more effective and efficient, at getting more out to the households. Is there enough political will to do it? I don't think that's what we're hearing right now, because we're hearing more about cuts to the safety net rather than increases. So I wish we had enough political will. And again, it can surprise all of us. You just never know what will happen, but just not quite hearing that. And I know that Jalen's on, so Jalen, if you have a comment on that.
No, I don't really have a comment on that, Jan. I mean, I think like you said, there is political murmurings of, cutting SNAP off the Farm Bill and separating it and block granting it out to the states. And we just saw, I think it was Iowa yesterday. I forget what state it was in the Midwest, passed really heavy restrictions on their own SNAP program eligibility. So yeah, we're seeing how this is working, but they're also seeing how it's creating a political backlash to quote unquote, get people off of government assistance and get things back to normal. So yeah, I'm not sure where it's going to go.
But we can all hope.
And David had a follow-up, or sorry, Jalen had a follow-up question about the COVID COVID exceptions expiring, and yes, that's it.
From what we have seen is that they are going to stay in place as long as the national public health emergency is there. States can opt out of some of them, and North Carolina hasn't thus far. But other states had stopped the emergency allotments before now. And now, as I say, with the omnibus, the 2023 consolidated appropriation bill passing, it ends, at the end of February. So, my understanding is they will stay in place through those that, will stay in place unless through the end of the public health emergency, unless states have the option to opt out. And right now we know that the public health emergency expires April 11th, and that Secretary Becerra has said that he will give 60 days notice if it's not going to be extended. So, and he has adhered to that in the past. So around, around February 11th, we'll be here. We'll kind of have an idea of whether it's the public health emergency will be extended.
Well, I'm sure maybe more questions will come up. So yeah, feel free to put them in the chat or just unmute. I do want to share out some ways that you can get involved. I see many familiar faces and folks that I've never seen before. So if you are in North Carolina, we would love for you to join our coalition. I'm going to put our email in the chat and also a Google Sheet if that's easier for you to just fill out right now so that you can join our listserv. I promise we do not email excessively. And yeah, it's a really great resource to get information about what we're doing and policies that are coming up. Sorry, the train is going by my house now. And then another really important thing you can do is let us know what federal district you're in. And I will also put that Google Sheet or form in the chat, which that way when we are working to meet with our representatives to advocate that they sign on to these really crucial bills, we can reach out specifically to folks in their district and have some real life stories, which we have found to be really effective when connecting with our representatives. And then, yeah, we also have a membership. It's free to join. There's no membership fees. You can join as an individual or with your organization. And yeah, I just encourage folks to join the coalition and come to our monthly meetings. It's a really great place to build community and learn, and also do really crucial advocacy and kind of help folks throughout the food system keep up to date. So I'm gonna stop sharing my screen so I can put those links in the chat. But again, if you want to join the listserv, the email is mcfoodadvocacy@gmail.com. And if it is easier for you, you can fill out this Google Sheet and we can add you that way. Oh, and I'll also put yeah, Lauren, I'm seeing what you're I don't know, Jan, if you have more insight on that. But I am gonna put the link to find your legislator, because I know the district just changed in the last election. So you click that link and figure out what district you're in now. And then you want to fill out the other Google form to help us figure out, yeah, what district folks are in. And that helps us be a little more organized when we're trying to meet with our representatives.
I muted myself, sorry. Lauren, I saw your question. That, it gets so easy to get them confused with the public health emergency and then what has just happened with the ending of the emergency allotments, which it isn't the end of, the public health emergency is still in place and it's just the end. It's only the emergency allotments that are ending. The other waivers that are in place, like for college students, the ABOT, everything else is still in place during that time. It's just the ending of those benefits. And I don't, what we are hearing is that is going to be basically a decrease of $80 per individual, not per household. So for a family of 4, that's going to be about $320 a month that they're not going to have to go for, and we're still seeing high price food prices are increasing, they're not coming down. So it's going to be tough for those households.